Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Hot flashes, fatigue, weak bones. These are usually symptoms associated with menopause in women. But as men age, their testosterone levels go down and they can experience these same symptoms. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Today we talk about why low testosterone should be a high priority for men's health. Stay tuned. Welcome back. Joining us today is Dr. Roman Hendrickson, board certified in family medicine and geriatrics, who is here to talk with us about testosterone and the important role it plays in men's health. Welcome, Dr. Hendrickson.
Thank you.
So, question for you. I think a lot of people understand that testosterone is a hormone in men, but can you explain it a bit further? Talk about what it does.
Well, it's known as the male hormone because men make more of it than women do. It's associated, of course, with sex drive in men, but also capability to be able to have sex. It also affects bone and muscle mass, affects red blood cells, endurance, and a variety of other things, including mood.
So testosterone levels go up with puberty, and then they go down. When does that start?
Sort of peaks out around 30, and then it starts going down about 1% per year. Other things can affect the levels of testosterone as well.
So what are some of those things that cause decreases in the testosterone level?
Decreases in testosterone can occur due to injury to the testicles, changes in the pituitary gland, which is located into the skull and the brain, cancer treatments, chemotherapy, certain medications such as hormones that are used to treat prostate cancer, chronic diseases such as kidney disease, liver disease, alcoholism, certain medications, smoking can have a negative effect on testosterone, obesity, and even stress.
So when we talk about those testosterone levels being low, what does that mean?
Well, we can measure the testosterone level, and they usually run somewhere between 250 to about 1100. Men with testosterone levels somewhere in the range below 300, give or take, may experience the effect of low testosterone, or some people call it low T, just to not pronounce the long word.
So what are those symptoms of low T as you describe it?
I think the first thing that most people would recognize is the loss of sex drive, so lack of desire for sex. But along with that is loss of ability for men to get an erection or sustain an erection. So if you can't get an erection and there is no desire for sex, then you have to question whether there's a possibility of low testosterone. Other things that can occur are mood disorders, such as depression. It can affect memory, so that there's depression, difficulty recalling things, hair loss can occur, fatigue and loss of endurance. So people just kind of poop out a little quicker than they normally would. Loss of muscle mass, some decreased bone density, so the bones are not as strong as they were. People can get fractures easier. Weight gain, the distribution of fat changes, especially men may notice that their abdomen gets bigger disproportionately to their arms and legs. They lose the muscle mass in their arms and their legs, and their belly gets bigger. That can be associated with low testosterone. Also, hot flashes. Men who have low testosterone, just like women with low estrogen, can get hot flashes and sweating.
So what are the implications of those symptoms? Is low testosterone dangerous?
Well, you can have decreased bone mass, which would allow a man to have fractures easier. You can lose muscle mass, which makes you have less strength and ability to do normal tasks. Weight gain obviously is not a good thing, but the type of weight gain that can occur with low testosterone can be what we call visceral fat, which is the deep fat that can form around the organs in the belly. Diabetes can occur more commonly in men who have low testosterone.
So when should a man see his physician?
I think the more symptoms that a man has that fall into this category, the more concerned they should be that this is a possibility, especially lack of sexual desire, lack of ability to maintain an erection. Then when you add that to the constellation of difficulty with energy levels, maybe more depression, weight gain, those things all point in that direction, and at least they should have the testosterone level checked.
So what does a doctor do to find out if those symptoms are really symptoms of low testosterone levels?
I think the main thing is to just get the level checked first, and then if the level is low, a lot of it can be followed, and you treat the low testosterone. You may have to treat some of those symptoms independently, or you can watch and see how many of those symptoms improve once the testosterone levels are improved. Of course, if you're overweight and they're caused by low testosterone, if you don't work on the weight loss and improve the testosterone, you can't solve that problem because one makes the other worse.
So in the few seconds that we have left, sometimes a man might be a little embarrassed to talk to his physician about an issue like low testosterone. Can you give men in the audience some advice?
I would say if you talk to your physician and say you're concerned about your sex life, that this may be something as a lead-in to talk about the testosterone.
Very good. Thank you for the information. Well, we need to take a break, but coming up next, if your symptoms are caused by low testosterone, what are your options? And what are the risks and benefits of different treatments? We have a lot more to talk about. Don't go away.